Bismillahirrahmanirrahim. Welcome to my new class. This is my 8th lecture. So in this lecture we will discuss about the nursing implication for corticosteroid therapies. Let's suppose when we are going to recommend a drug in the form of corticosteroids, so what are the basic protocol which must be followed by the nurse? So these are the assessment scales, assessment and drug effects, so you can check it. I have already that has been given here. So first of all, nurse is responsible to establish the baseline and continuing data on the BP, weight measurements, fluid and electrolyte balance, as well as the blood glucose level. So it should be checked. So these are the basic, you can say he or she should establish the baseline, and he or she should collect the this data on BP, blood pressure, weight measurements, fluid, electrolyte balance, and blood glucose. Now the second one is lab test. So this is also very important. So let's suppose a patient who is on corticosteroid therapy. So lab test, it is for investigation, it is very important. So periodic serum electrolytes, blood glucose should be checked, LCT, hematocrits and hemoglobin, the platelet count, and WBC with differentials. Monitor for adverse effects older adults and patients with low serum albumins are especially susceptible to the adverse effects. Be alert to the signs of hypoglycemia. Let's suppose if the patient is hypoglycemic, so what are the precautionary measurements which should be adopted, which must be adopted by the patient, as well as the nurse is responsible to give a proper protocol to the patients. And ophthalmoscopic examinations, they are recommended every 2 to 3 months, especially if the patient is receiving ophthalmic steroid therapies. Monitor for continuous or persistent baggage or chest pain, compression, and spontaneous fracture of long bones and vertebra present hazards. The nurse is also responsible to monitor for and report changes in mood behavior, especially the emotional instability of the patient, the psychomotor activity, as well as especially with the long-term therapy. The nurse should be alert to possibility of the marked infection and delay healing, anti-inflammatory and immunosupportive action. It should be noted down that the dose adjustment may be required if the patient is subjected to severe stress or serious infection, surgery or injury. And secondly, it is also very important that for a single dose of corticosteroids or the use for a short period, mean less than 1 week, do not produce any withdrawal symptoms. If the therapy is discontinued, even with moderately large doses, expect a slight weight gain with improved appetite. After dosage is stabilized, notify physician of a sudden slow but steady weight increase 2 kg or 5 lb per week. And it is also very important that to avoid the alcohol and caffeine, so which may be contributing factor to the steroid ulcer development and long-term therapy. So here patient counseling is very important regarding from each and every point of view. For example, do not ignore the dyspepsia with hyperacidity. So all these things should be under investigations. Report the symptom to the physicians and do not self-medicate to find relief. Do not use aspirin, acetyl salicylic acid or other over-the-counter drug, OTC drugs, unless the prescribed specifically by the physicians. Note, let's suppose this should be noted down. Let's suppose if there is high protein, calcium and vitamin D diet, it should be advisable in order to minimize or reduce the risk of corticosteroid-induced osteoporosis. Notify physicians of slow healing, any vague feeling of being sick, or return to the pre-treatment symptoms. Do not abruptly or quickly discontinue the drug doses, they are gradually reduced to prevent the withdrawal symptoms. Report the exacerbation of the disease during drug withdrawal. Carry medical identification at all the times and at need to indicate medical diagnosis, drug therapy and name of the physicians. So actually this is the nursing protocol which is provided in the hospital. Let's suppose if the patient who is on the corticosteroid therapy, apply the topical preparation sparingly in small children, while the hazards, the risk of systemic toxicity is higher because of greater ratio of skin surface area to the body weight. Check the shelf life date on topical corticosteroid during long-term use. Do not breast feed while you can say taking using this drug without consulting physician. So especially in case of breastfeeding, so while taking using these drugs without consulting physician, it is also very important. So before this you should clear yourself. After that you can recommend it any drug to the patients. Now come toward the posology of the dosage of corticosteroids. So as we know that corticosteroid, there are different type of drugs which are available and different doses and different dosage form. So the first one is betamethasone. So as we know that betamethasone this is corticosteroids. Pharmacologically betamethasone is corticosteroids. So for oral dosage form they are available in syrup, tablets and effervescent tablets. So betamethasone can be given to adult and teenager. The dose may be ranges from 0.25 to 7.2 milligram a day, as a single dose are divided into several doses. For children, the dose is based on the body weight or size and must be determined by your doctor. So if you remember in my lecture number 57, so you can study there. I have already discussed about the different drug calculation, how to find out the different doses for the child, for adult and for geriatrics. So you can find out all these lectures. I have already given many lectures especially on drug calculation, so you can check it, and if you have any problem regarding the dose calculation, then you can directly contact me through WhatsApp. Inshallah, I will clear to you people, inshallah. For long-acting oral dosage form, the extended release tablets, for adults and teenagers, dose may be ranged from 1.2 to 12 milligram injected into the joint lesions, muscles or vein are often necessary as determined by your doctor. In the same case in children, the dose is based on the body weight. For example, let's suppose if the drug is given to the patients by body weights, for example, that is 2.2 milligram per kg body weight. So let's suppose if the weight of the person is, if the weight of the patient is for example 10 kgs, and then you can say the dose which is required for that patient is 20 milligram per kg body weight. Another person, let's suppose the dose which is given in the literature, so the dose is, let's suppose 3 milligram or 4 milligram per kg body weight, and the weight of the person is 20 milligram, then you can simply multiply it. So you can say normally the dose which is required for that patient, so then you can, according to the conditions, it means you can adjust the dose according to the condition of the patient. For injection dosage form, for adults and teenagers, so these are also available in the form of injections. So for adults and teenagers, 2 to 6 milligrams per day it should be given to the adults or teenager whose age is from 13 to 19 years. So for children, the dose is based on the body weight or the size and must be determined by the medical practitioners. The second one is budesonides. So these are long-acting oral dosage form or extended release capsules. So they are also available, and tablet capsule forms for adults, budesonide, which also come under the category of corticosteroids. So at first the dose is 9 milligram a day for up to 8 weeks. Then your doctor maybe decreases the dose up to 6 milligram a day. Each dose should be taken in the morning before breakfast. For children, use and dose must be determined by your doctor, by the medical practitioners or pharmacists. So there are some formulas. Through these formula you can easily find out the dose for the children's. As I have already discussed all the dose calculation in my previous lecture, so you can search it, and if you have any problem, so you can contact me. The third one is cortisone. So cortisone for oral dosage form for tablets, adults and teenagers, 25 to 300 milligrams a day. As a single dose are divided into several doses, and for children as the same conditions. For injection dosage forms, adults and teenagers, 20 to 300 milligram a day injected into the muscle. So 20 to 300 milligrams a day they can be injected into the muscle, because most of majority of the corticosteroid, those drugs, for example betamethasone, dexamethasones, or you can say beclomethasone. So all these are anti-inflammatory agents like decadron. So decadron, they are available in the form of injections. As well as there are other drugs which are available, for example Canacort. So they are also available in the form of injection, while some of them they can be given to the patients topically, like you can say dexamethasone. So dexamethasone, they are also available in topical form, in cream form, in lotion form. So for children, the dose is based on the body weight or size and must be determined the practitioners. Now come toward dexamethasone. Dexamethasone is another anti-inflammatory agent which belong to the corticosteroids. For oral dosage form, elixir, they are available, and as well as in elixirs, oral solution and tablet form. So they are available in different dosage form. For adults and teenagers, so they are available, it can be given at the dose of 0.5 to 10 milligram mg, taken as often as necessary, is determined by your doctors. For children, the dose is based on the body weight or the size, must be determined by your doctors or practitioners. For injections dosage form for adults, the normal dose is 20 to 40 milligram or 20.2 to 40 milligram injected into the joints, lesion and muscle, and when often necessary as determined by your doctor. So for children, that is recommended according to the body weight of the patient. Hydrocortisone. So hydrocortisone, this is the most, you can say, well-known corticosteroids, hydrocortisones. So they are available in oral dosage form, in oral suspensions and tablet. So the adults, for their dose for the adults and teenagers is 20 to 800 milligrams every 1 or 2 days as a single dose, or divided into several doses. For children, as the dose is recommended already depend upon on the body weight, and it must be determined as I have already discussed. For injection dosage form, adults and teenagers, 5 to 500 milligram, they are injected into the joint, lesions, muscles, or vein under the skin, are often necessary, so as determined by the medical practitioner. So there are some formula. Through this formula you can easily find out the dose calculation. Inshallah, in my upcoming lectures, inshallah, I will calculate and I will make it easy for my students for facilitations, inshallah. And children, as the dose is recommended already, we have discussed that it depends upon on the body weight and size. Fifth one is methylprednisolone. So this is another corticosteroid, methylprednisolone. They are also available in tablet form. So in adults and teenagers, their dose is 4 to 160 milligram every 1 or 2 days as a single dose, are divided into several doses. And it's the same case for the children, as I have already mentioned in the above lectures. For injectable form, so methylprednisolone, they are also available in injectable form. For adults, the dose is 4 to 160 milligram injected into the joint, lesions, muscles when on upon necessity determined by the doctors. Prednisolone. So prednisolones, this is another corticosteroid drug, so they are also available in oral dosage form, oral suspension, syrup and tablets. For adults and teenagers, the dose is normally 5 to 200 milligrams, taken as often as necessary is determined by the medical practitioners. For injectables dosage form, the adults and teenagers, the normal dose for the adults and teenagers is 2 to 100 milligram, which is injected into the joint. So in the same case, we have discussed and other anti-inflammatory agents which belong to corticosteroids. Another one is prednisone. Prednisone, they are also available in oral dosage form, oral solution. So a oral solution form may be available, a syrup form may be, or a tablet form may be available. Adults and teenagers, 5 to 200 milligrams every 1 or 2 days as a single dose, are divided into several doses. Triamcinolone, this is the last one, corticosteroids, which is available in oral dosage form, in the form of syrup, in the form of tablets, and adults and teenagers. For adults and teenagers, it is required 2 to 60 milligram per kg body weight. So as a single dose are divided into several doses. So as well as the same dose, the dose is based on the body weight for the children's, so depend upon on the body weight. So for injection dosage form, adults and teenagers, 0. And so there are also triamcinolones is also available in oral dosage form as well as in injectable form. So an injectable form for the adults and teenagers, 0.5 to 100 milligram injected into the joint, lesion or muscle and under the skin is often necessary determined by your doctor. So inshallah, in my next lecture, inshallah, I will discuss more about the dose calculation, how to calculate the dose for the child. So there are some formulas when inshallah I will put these formula, and through with the help of these formula you can find out the dose of all the corticosteroids. Thank you so much for watching my lecture.